I'm Kelvin Pitman, and I was in the Oversight Committee of the British Heart Foundation Data Science Centre. I guess with the British Heart Foundation, I got involved with that when I first had a heart attack, I suppose, shortly after I had a heart attack. But I've always been interested. My dad was one of the very first to have an artificial valve back in 1966, which was right at the very beginning of that sort of open heart surgery. I'm a scientist by training, and I've always worked with a lot of data, and because I had an interest in data anyway, this was something I realised that we really had to get into this in a much better way than we have been. I think getting the public involved is very important because patients really, most people don't understand data at all, or at least not very well. And if they really did understand it, they would know just how powerful it is, not only to research, but also to themselves. And I think the more patients get involved, the easier it is to be able to explain to patients. Patients can explain to patients a lot better than perhaps some of the clinicians can do so. There is an enormous amount of data in the UK, in the NHS, because it started in 1948. I think people have been sceptical about data for a long time. They're worried about losing some of their own personal data in all of this. There's data about almost all of us going way, way back, and that's incredibly valuable, much more valuable than any other data set in the world. The recent pandemic, I think, has caused people to understand just how powerful that is. Hopefully I've helped encourage patients to get involved. I've helped clinicians to get involved with patients, and I hope I've been able to move on understanding of the way in which data is being used and free it up a little bit.